Hello dear viewers, and we're back again right here at Good Morning Kuwait with our first guest. So now many people think they take good care of their teeth, but sometimes simple mistakes can affect their health and the success of any cosmetic dental work. Now today we are asked about the most common errors and how to maintain a healthy, beautiful smile that lasts forever. Now we will welcome Dr. Rija Lifdawi, cosmetic and restorative dentist, and hello and welcome to the show.
Hi, how are you? Thanks for having me.
Weather is beautiful these days.
Amazing.
It is
nice and chilly, huh?
Yes. So many people believe they take good care of their teeth, yet unknowingly make actual harmful mistakes. From your experience, what is the most common ones?
Well, there's a lot, to be honest, but it ranges from the selection of people's toothbrushes to the frequency of brushing, the type of toothpaste used. A lot of people think these things are good, so they overdo it sometimes, and that's your major issue.
And I know that people actually supposed to floss before they brush their teeth. People take it the other way around. They're thinking that flossing is after.
Yeah, what you do is you want to loosen up that debris after you brush, and then with the water floss add on and clean those surfaces. Because when you're brushing, you're basically brushing one surface, two surface, three surface, and there's two surfaces you're missing.
Oh yeah.
So it's essential to hit those places
and
as well.
And also for the bristles to get within the teeth once you actually floss them.
And nice and gentle, always. That's the take home.
Nice and gentle. So teeth whitening has become very popular here in Kuwait. When does whitening help, and when does it start causing damage to the teeth?
Well, I think everything has to be supervised well. A lot of people try to do this stuff at home. Now, when you're bleaching at home, you can't really do the same things the dentist does to control for safety. So you can't protect the soft tissues. You might get soft tissue burns at home. You might overdo it with the bleach, get sensitivity, and actually cause more damage than what you're trying to achieve. So when it comes to that, it's important to get it done supervised with a dentist, and even with whitening toothpastes, for example. They're not actually whitening your teeth. They're removing the stains, so they're abrasive. So you don't want to overdo that too, because the enamel, once it goes, it won't grow back. It's not like nails and hair. If it's gone, it's gone.
That's why I always thought that whitening was actually putting a pigmentation on top of the teeth, but then I found out it's actually removing even the protective layer, or a slight...
it penetrates into the tooth.
And then it just shows the color white. Now, talking about that, using also hard brush and hard forms of brushing can actually hurt your teeth. Could you explain that a little bit more?
Yeah, the concept here in dentistry, we call it abrasion. Now, it's a dynamic environment. Your teeth are always going to get attacked, either by acid or by a foreign substance like a toothbrush. Now, with abrasion, let's say we're brushing twice a day. That's 14 times a week, if you times that by 7 days, and times that by 52 weeks in the year. That's around 730 times you're brushing your teeth. So at the end of the day, you're going to end up wearing away that valuable enamel that you want. And you're going to start getting gum recession, sensitivity of your teeth. You have to, I always recommend you go for an ultra soft brush. And it's about technique, not how hard you brush.
And as you said, you do it over 700 times a year. So it is something that accumulates with day by day. So the more that you take care of it, the more it's white, the more it's healthy. Gum, teeth, even the bacteria that lives in there, the healthy ones, could actually stay there rather than just brushing them away.
You keep a nice environment.
You keep
good
residence.
Yes.
So some people undergo dental restoration and cosmetic procedures without a proper diagnosis. So what are the risks that carry improper diagnosis?
You have to diagnose properly before getting any treatment done. I don't recommend just going getting it done. You need to know what the pros and cons are, what is involved, and does the tooth actually need that treatment or not. Now, when you start thinking about cosmetic dentistry, you have to keep in mind that it's a dynamic environment. We eat all day. I can't control what you do when you go home. I can get you the most beautiful veneers, but if I don't diagnose properly beforehand, I won't know which material to use, my type of preparation. Is the veneer going to only be on one surface, or do I need to fully cover the tooth from the acidity in your diet? The proper diagnosis is the most essential thing, to be honest.
And with proper diagnosis is honesty also. The patient has to come with honesty, telling 100%. Them exactly what are their habits. If they actually can go with, let's say for example, a steel, for example, steel braces or clear braces, they have to know that if they can actually take the 22 hours
Of
with the clear
course.
one, or should you push with the steel ones?
They have to be highly motivated. It's all about patient selection as well. So if I think the patient is not really into wanting to move his teeth perfectly, or is not going to be committed, because it's a commitment at the end of the day.
Yes.
You can buy the most beautiful Ferrari. If you don't take it to service, you're going to start getting issues.
Yeah.
Same thing with dental work. So if you're going to take it and service it, it's going to go for miles.
And that car will be just another barn find after 20 years.
Yes, exactly.
So are there daily habits people practice thinking they are beneficial, but reality slowly takes it another direction?
Habits, health-wise, I think.
Yeah.
I get a lot of people that drink a lot of lemon water, apple cider vinegar. Now keep in mind, this is all acid. So we were talking about the different types of ways your tooth can erode. We talked about abrasion. This is erosion. So the acid can either be from our diet or from a medical issue like reflux disease where the acidity comes into the mouth and stuff. So over a long period, these healthy habits, so-called, that we think, they might be healthy for your health, but they're not really great for your teeth, so you have to be wary of that.
But how can I balance it? Like if I want to have, let's say, a small cup size, let's say cup size of apple cider, should I wash it down with water, or
100%.
should I just like leave it?
I would always recommend to dilute it down.
Okay.
You always want to dilute things down. I always use straws. I try to avoid my teeth, especially with coffee and stuff, because coffee is quite acidic as well. So I'd go for an iced coffee instead of hot coffee. It's all about choices. You can still do what you want to do, but you try to think more about what the teeth are going to be getting, you know?
So when these small mistakes actually accumulate over time, they often affect not only dental health, but also success of cosmetic results. So how can actually these things be prevented in some way?
It all goes back to the proper diagnosis. I diagnose well, I know their habits, and then we see the best treatment option for them, and then I can give them the best advice for that to last. But you have to service it. People think, I got my teeth crowned, I got my veneers done, I don't even need to brush them anymore. It's ceramic.
Oh, okay.
Yes, it's the opposite. Your story starts here, and you can keep it nice and healthy and treat them just like your natural teeth.
All right. So we often see smiles that look perfect at first, then it deteriorates over time. And this is what you're talking about, that even though if it's ceramic, it should be also serviced in some way. It's supposed to be treated, even though if it's a different compound, not bones, but ceramic, they do still are affected by acid or abrasion.
Of course, 100%. And I always say, it looks good from afar, but when you're up close, it's far from good, you know?
It's far from good. Now, how much does rushing results by patients or even dentists impact a long-term smile or result?
I don't think the patient should ever rush the dentist to get it done, and I also don't think the dentist should rush to get the work done. It's like going to a Michelin star restaurant and telling the chef, quick, you've got 10 minutes, I want the best meal ever. He has to take his time to get it done. Or going to the barber and saying, listen, I have 5 minutes, I want the best haircut. It doesn't work that way, especially with medicine. So we want to do things proper, we don't want to miss steps, you want to be by the book. So it's your duty as a dentist to give your patient that time.
All right.
You know?
Now, we also talked about the healthy, or the unhealthy habits that actually cause problems to your natural teeth. But what are also the bad habits that you can also think of, other than the ones that we mentioned, that also can cause the cosmetic ones to fail?
People have habits, biting pencils, biting nails. This causes chips in the ceramic as well. So when I take the patient history before, I actually go into all this and ask them about their habits. It's not just, what's your medical history like? Is it okay? I need to know lifestyle. Because keep in mind, it's a dynamic environment. Teeth get a lot of hitting, especially when we're eating, we're biting. I can control what you eat. So when you go home, it's all on you. So if I have an idea of what the environment's like, I'll be able to kind of avoid those issues.
All right. So is there a difference between a camera-ready smile and a smile that is clinically sound and built to last?
Yeah, that goes like that far from good.
Exactly.
So it has to be, if the tooth needs treatment, we get the treatment done. You might come to me with teeth and saying, I need veneers. If I look at them, I'll say, listen, they're beautiful. You don't need veneers. Maybe you just need to whiten your teeth safely at the dentist, not at home, obviously. So that's the golden rule, I think. You know, you need to you need to think about it just before you get it done. It's a commitment, and get the right thing done.
All right. So talking about the golden rule, so what is the golden rule to actually make it last?
To make it last, stick to natural.
Okay.
Go for conservative dentistry. There's more than one approach. I can go to this dentist. This dentist can tell me I need 20 veneers. I can go to another dentist. He might tell me I need 4. And someone else might tell me I need to get a bleaching. So it's your right as a patient to go get your different options and weigh it all out with your pros, with your cons, and then you make that informed decision. If you go somewhere and you feel rushed, yalla, let's get your teeth done now, you can say, stop, get me out of here, I need to think about this. You know? It's your right as a patient.
Exactly, it is my right, and it's also your right as a dentist to basically know the history and be, have that kind of like conversation with the patient to know exactly his history, his habits, and how to actually make these cosmetic changes last for longer.
Yes.
And it's been a wonderful conversation with you, Dr. Raja, and we hope to see you soon again. Thank you so much for being here.
Thank you so much for having me. It was a pleasure.
You're welcome so much. All right, we want to thank Dr. Raja Lifdawi, who is a cosmetic and restorative dentist, who is actually also our guest for today and our first guest. It was a very beautiful conversation. Now, next we have a report about Iranian carpets are more than decoration. They are threads of history and culture, woven with with skill and patience. Each carpet reflects its region, materials, and traditions. Beyond their beauty, they carry social and cultural meaning. Now, connecting generation, despite modern changes, this century-old craft continues to thrive as a symbol of art, heritage, and identity. Now, more details in the following report.